My name is Rhea Siddagunta. I go by Rhea Sid. So I am a first year student at the Georgia State University, and I'm currently studying biology. My presentation is really based on the technology and like the innovation to improve like the healthcare, specifically focusing on mental health and how providers can improve the clinical care given to people suffering through mental health. So I'm just going to be talking about like artificial intelligence, digital therapeutics, and telemedics, wearable technology, innovation therapies, and advanced drugs, and also how social media can maybe help. And I'll also finish up with a conclusion at the end. So, an introduction is mental health care is undergoing a revolution driven by rapid advancements in technology and innovation. Obviously, healthcare isn't the same as it was 100 years ago, so it's really undergoing a change every year. But now more than ever, there's a huge change in technology, right? So a lot of different types of technology is being used to help the healthcare providers have a better diagnosis and better help patients with their prognosis or help to curing them. So a lot of these technologies can include artificial intelligence, which can predict like mental health disorders based on behavioral patterns, wearable technology that provide real-time feedback on emotional states, the integration of cutting-edge technologies in empowering both patients and clinicians in unpredictable ways. Also, as we move forward, the fusion of clinical medicine with these groundbreaking innovations holds the promise of improving outcomes and enhancing the quality of life for millions of people around the world. So, in my presentation, I'm just going to be giving you guys a few examples on these cutting edge technologies. So, 970 million people, essentially one in every eight people, are living with a mental health disorder. So, these technologies can really help us cure a lot of these people. So, the first technology I'm going to be delving into is artificial intelligence and mental health diagnostics. So AI-powered tools like chatbots and diagnostic algorithms are being developed to assist clinicians in identifying early signs of mental health disorders. For example, machine learning algorithms can analyze patterns in speech, text, and behavior to predict conditions like depression, anxiety, and bipolar disorder. So, case studies. Research has demonstrated that AI systems can diagnose depression through voice analysis with significant accuracy, enabling more time intervention. So obviously, AI can never replace humans completely, like it can never replace a doctor, but it can be of significant help to a doctor or a healthcare provider in identifying these mental health disorders. So, next thing is digital therapeutics and mobile health applications. So, mobile apps such as Headspace or Calm, and they offer a lot of like behavioral therapy devices. So, these apps, they essentially give like few exercises or they come up with ways to help you reduce your mental health, like anxiety or depression in real time. So, studies show that digital therapeutics can significantly reduce symptoms of depression and anxiety. So, next, telemedicine and virtual reality therapy. So, telemedicine is pretty easy to understand. So, it's basically where a doctor or your healthcare provider is online. So, they could be on a video call or like on a Zoom call, and they would just go about with their diagnosis the same way as they would in person. This can be really helpful for people living in rural areas or people who don't have very much access to big healthcare systems. VR-based therapies include like the virtual reality systems that can be used to help provide therapy for PTSD patients. So as shown as these pictures over here. And then wearable technologies and biofeedback. So wearable technology, I'm sure a lot of you guys might have at least had or have heard about like a smartwatch, like an Apple Watch. Um, it's really cool that we can track the steps we take in a day, how many calories we burn off, and how our heart is functioning. So technologies like these smartwatches and fitness bands can be used to track various psychological signals. So, and also biofeedback is a way that allows patients to understand their physical response to stress and anxiety in real time. This can help them develop mechanisms like breathing or mindful exercises. Then we have some neurostimulation technologies, such as treatments like transcranial magnetic stimulations. So as you can see in the picture right here, this kind of just looks like some very fancy like technology, but this can actually track the nerve cells and other I guess like systems in your body, and it can track how your body is reacting to a certain drug. And this can really help in diagnosing the patient even better. So then mental health and social media monitoring. So social media platforms are being used as tools to monitor and predict mental health crises. For example, I think I was on TikTok the other day and I searched something related to some content about like suicide and, just kind of sensitive topics, right? And I think there's something popped up on my screen being like, here's the suicide hotline. If you need help, you can go reach out. So even though many people might not even choose to go that route, someone is going to click on that mental health hotline and get some help. So it's really great that at least someone is getting the help they need through these social media platforms. So yeah, and just to conclude, I think that all of these innovations, I know I just kind of touched base on a little bit of them, and they really, really help in the mental health diagnostics, and they help patients seek better care and just make themselves feel better. And these technologies can help millions around the world.
Yeah, thank you,
Yeah.
Rhea, so much for your presentation. So now we take question from audience. You guys can send it in the chat or you can use the raise hand function to ask question. We have a question from Tony. With
Okay.
with treatment or innovation do you personally find the most promising?
Okay, yes. So let me see if I can go back to that slide. I think a lot of these are pretty promising, right? Like VR therapies, the telepsychiatry are really cool, but personally, I think wearable technology is really, really the most promising because it's on you like 24/7, right? Like if you can choose to wear it almost like the whole day every day. So I feel like it just gives like a better accurate description of how your physical health is like, and maybe like how the physiological signals are coming up, like your heart rate and like how much calories you're burning and all of that kind of stuff. And there's a bunch of different kinds of wearable technology as well.
Yeah, we have the second question from startups.
Okay.
Should we be worried about data privacy?
Yes. So a lot of these studies, they are very like they do focus on data privacy. Like for example, I think this could be a good example, the neurostimulation technologies. So a lot of the research that's been going on in labs, the doctors and the physicians and the researchers, they make sure that the patient or whoever's undergoing that treatment, they do have the privacy. They usually maintain this in like electronic health records and, in their lab, like notebooks and stuff like that. So I think there isn't such a huge worry about data privacy. But obviously things can go wrong. Like, technology can like backfire sometimes and it might do something crazy where all the information is released. That is something we kind of should be worried about, but so far right now, there hasn't been any situation like that.
And the last question is how can social media platform or app create a balance with promoting mental health and general content?
Okay, that's a really cool question. So I think social media apps, they obviously their focus is like to have like, like cool content, like entertaining content, right? But I feel like they can have a slight balance between that and mental health. Obviously, a social media app cannot completely become like a mental health related app. It's obviously going to be like the most entertaining app that you'll go on, and that's what draws people in, I feel like. So, by drawing people in with the general content and promoting mental health at the same time, I think it creates a balance within itself because if people are coming on to get some content and they end up finding like a mental health related topic that they're willing to learn about, it, balances their endurance of getting the general content as well as getting stuff related to mental health. So I hope that answers that question.
Yeah, thank you, Ria, so much.